In this session, I would introduce to you how to critically appraise a research paper using the CAPS Systematic Review Checklist. Critical Appraisal Skills Program defined critical appraisal as a process of carefully and systematically examining research to judge its trustworthiness, value, and relevance in a particular context. In other words, it's about looking beyond the headlines of and systematically evaluating research to ensure it is valid, reliable, and applicable to your clinical question. Now, let's talk about three core concepts at the heart of critical appraisal. The first, validity, which refers to how well a study is designed and conducted. Does it actually measure what it claims to measure? Are the methods robust and free from systematic errors? Second, reliability is about consistency. If the study were to be repeated in a similar context, would it produce similar results? And third, the relevance. Relevance asks if the study matters to your specific clinical question or context. Even a valid and reliable study may not be helpful if its findings don't apply to your patient group or your healthcare setting. Understanding this concept ensures that you evaluate not only the quality of the research, but also the usefulness to practice. There are several widely used tools to help systematically appraise research. CAPS checklist, tailored to different study design and provide straightforward questions to guide your appraisal process. CEBM tools, a range of critical appraisal worksheets and resources for more advanced appraisal. JBI checklist, comprehensive and suitable for a wide variety of quantitative and qualitative research. The SIGN checklist, widely used in the UK for appraising the quality of evidence underpinning clinical guidelines. The risk of bias tool, particularly useful for assessing potential for bias in randomized trials and is commonly used in systematic reviews. Using these tools can help ensure a structured, transparent, and repeatable approach to critical appraisal. Today, we will consider the systematic review with meta-analysis of randomized control trial checklist. This checklist has 5 sections with 10 questions across the sections. Section A is about the validity of the study design. Section B reviews how sound the methodology of the paper is. Section C looks at the trustworthiness of the results of the systematic review. Section D are the results of the systematic review relevant locally. And Section E, will the implementation of the results represent greater value to your service users or your population? Now, this is what the CAPS systematic review checklist looks like, and it can be accessed from the CAPS website, where they have a list of checklists. When you have a paper that you want to critically appraise, you look at the checklists that are available and select the checklist that aligns to your paper. For today's example, we're looking at the systematic reviews with meta-analysis of randomized control trial checklist. And this is what the checklist looks like. So we have the checklist with the 5 sections, and each of the sections have questions. And these questions offer series of prompts that would help you appraise the paper. The response options that are available, we have the yes, the no, and the can't tell. The yes, when you look at the paper and you have sufficient information answering the prompt questions, then you're able to select the yes option. If otherwise, you have to select the no option. And the can't tell option is when you do not have sufficient information to be able to answer the question. This is an example of a completed checklist for the first question in section A. The first question, which is did the systematic review address a clearly formulated research question? We looked at the research paper, identified the aim of the paper, the population, the intervention, the comparator, the primary outcome, the time factor, the setting, and then we had sufficient information to be able to answer if the research question was clearly formulated, which was yes, because we had detailed information. Next, in section B, which aims to answer the question on how the review was conducted, you look at questions around were methods for selecting, assessing, and combining studies transparent and systematic. Check if more than one reviewer independently selected the studies and assessed quality to minimize bias. Assess whether the review describes how quality of the included study was evaluated and whether the differences were resolved appropriately. You also want to check if the search strategy was robust enough. And in this section, you are able to answer the research question when the method that was used is robust enough. So rigorous method mean that the review findings are more reliable. In section C, which aims to determine the trustworthiness of the results, examine if the results are presented clearly with appropriate data synthesis. Look for an assessment of the quality of or risk of bias in the included studies. Check that the review details the characteristics and the results of the included studies and whether the findings are consistent. Look for assessments of heterogeneity and sensitivity analysis to ensure the results are robust and not unduly influenced by individual studies. Trustworthy results are backed by clear and honest reporting. In section D, determine if the results can help locally. Consider if the population, intervention, and the settings in the review are similar to your own local context or target audience. Think about the review findings. Are they relevant to your setting, your patient group, or your population? Consider differences in healthcare system, resources, or patient characteristics. Evaluate whether the outcomes measured are relevant and applicable to your service users or community. In section E, we decide if applying the results will benefit your patient or service users. Will implementation of the findings improve care? Would it improve efficiency, outcome, or experience? You have to weigh the potential benefits against any risk or costs and resource implications before deciding to implement changes based on the review. For further training or further information, you can access the Knowledge for Healthcare Learning Academy program, which is a self-paced e-learning program titled Critically Appraising the Evidence Base, and it is designed to enable the healthcare workforce build confidence in critical appraisal. Alternatively, You can watch the 7-module YouTube playlist demonstrating critical appraisal in practice using CAPS checklists alongside an open access research article. This playlist was created by the Cochrane Mental Health Group. You can also join us in the library for the critical appraisal training sessions. You'll find details of the training sessions and registration on the library website. You can as well request group training for your team by contacting the library. Thank you.